I'm Mike Walter in California with the latest IVIG access update. As patients from throughout the state of California gather here in Sacramento to urge their lawmakers to push for passage of legislation that would allow them to have access to IVIG in all settings for all patients.
Stacy Westerlin felt the need to be here. She came from Lodi, California.
I thought it was important to come out here to talk about the importance of receiving IVIG treatment.
At 28, Stacy was plagued by tingling in her toes and fingers. She knew something was wrong, but it took doctors 9 months to diagnose her with chronic inflammatory demyelinating polyneuropathy. IVIG treatments relieve the rigidity that grips her body, but getting the therapy hasn't been easy, and she's ensnared in a sea of red tape.
It's infuriating because it's just a runaround.
In addition to fighting her insurance company, for months she had to lean on her 75-year-old grandfather to regularly transport her an hour each way to get infusions, even though there is an infusion center just a few blocks away.
That's a huge commitment to ask of anybody, and you know, if I didn't have him to do that, I would not have been able to get the treatment.
I don't know how long it'll be. Okay. Thank you for coming, Grandpa.
IVIG is one of the few real miracle drugs that we have in the neurology world. It can be used for a lot of different diseases, but what's so amazing about it is that it can reverse patients' symptoms. So patients with a number of different diseases can be given the IVIG and can get stronger, can feel more, can walk better, can see better. And so it's a drug that we like to use in the right setting for those patients.
Now Stacy is getting her infusions at home. Nationwide, patients like Stacy are finding their voice and urging lawmakers to pass the Medicare Patient IVIG Access Act of 2009.
Please fix this. There has to be a simpler way for people to be able to access their medical care and being able to get access to this drug.
Helping to spearhead the fight in Washington is Michelle Vogel, the head of the Alliance for Plasma Therapies.
The labor unions are at the table, the hospitals, the health insurance companies, the medical societies, but not the rare disease groups. We haven't been invited to the table and will be impacted the most.
Vogel vowed to bring the fight to each state. She circulated a petition urging the California congressional delegation to support the legislation. The first to sign, influential Bay Area Assembly member Mary Hayashi.
And thank you very much for all your effort.
Thank you.
Thank you, Michelle.
Michelle was quick to thank the hundreds of United Home Care workers who marched to the steps of the Capitol to make sure their voices were heard. Vogel knows this is a matter of life and death. She shared the story of one patient, Pam, who she met and tried to help.
She was diagnosed with 2 diseases, CIDP, the same disease you just heard about, and polymyositis, an autoimmune disease that attacks the muscles. And she was in a wheelchair due to the fact that she could not get access to IVIG, and prior to that she was walking and she was living a life and she had a future. She begged for her life and asked for help. A year later, she died. The hospital no longer had an outpatient infusion center, and so there was nowhere for her to get treated.
Dr. Jeffrey Ralph, the director of the Neuropathy Center at UCSF Medical Center, talked about how reimbursements dropped so low that the infusion center at UCSF had to be shut down.
Previously, we had an infusion center in our clinic to administer IVIG for our patients. But after the reimbursement of IVIG changed, this infusion center had to close because of low reimbursement rates.
Dr. Ralph also urged lawmakers to co-sign the legislation, as he explained to those at the rally why IVIG, or intravenous immune globulin, works so well.
For many of these patients, IVIG works the best, and for certain patients, it's the only treatment that seems to work effectively. Without the treatment, patients will get weaker, and if they don't get the treatment for a prolonged period of time, they may become wheelchair-bound or even bedridden. So it's critically important that they receive infusions.
A parade of patient advocates from throughout the country also joined in the call for swift action from lawmakers.
The work that is being done today, the voices that are being brought to this forum today in California, as I say, join the national voices all the way across the nation and ultimately taking that message back to D.C.
Now that the petitions have been gathered in the capital of California, they're going to be brought back here to the nation's capital so that the voices of patients with rare diseases can be heard in the ongoing debate over health care reform. We urge you to also sign the online petition. And while you're at it, we ask that you contact your local congressman and your senators and ask them to co-sponsor these vital pieces of legislation so that patients with rare diseases can get access to IVIG, the life-saving therapy.